Everyone. It's another Wednesday with your fertility specialist. On behalf of Alps Hospitals, I love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying tuned. I'm one of your hosts, Ruth Ogogo, and it's always a pleasure to be with you every Wednesday. Today, we'll be talking about steps to preparing for IVF. As a matter of fact, I know a lot of people go through IVF and before seem to be in confusion as to what to do. And they have a lot of questions in their mind as to what this process is all about. How am I going to go about? Do I need to come and stay in the hospital period of this treatment? Well, today we're here to put an end to your question. We're here to give you great insights to what you need to know. And we have Ebra Olubi. So
Thank you very much, Ruth. Good afternoon, viewers. And I think I want to say thank a big thank you to our viewers for always engaging. We appreciate all the engagement. Please keep it up.
Oh wow, yes. So that's coming from Dr. Debbie. So viewers, thank you once again. Yeah, it means we can't stop thanking you guys for engaging us every Wednesday and Friday. Okay, so Dr. Deborah is a family physician. She's an IVF specialist and a fertility specialist. She's also the head of IVF unit at Alps Hospital. More like saying she's the IVF coordinator of Alps Hospitals. Wow. It's good to have you, Dr. Deborah.
Thank you very much.
So, viewers, drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them. Whatever your opinions are, please feel free to drop them. We'll definitely attend to them appropriately. As we start right now, share this link with someone, call up someone, because there's just a lot for grabs today. So please sit back and enjoy the show. So, Dr. Deborah, yeah, I was saying earlier on that a lot of people they have this should I say, vague mindset about IVF. They don't seem to understand everything about it, and they seem to be in a fix sometimes when they are praying for IVF. Even sometimes when they read about these things, they don't seem to be able to apprehend how or comprehend how this whole IVF process takes
Good.
them from beginning to the end, what they need to do, and you have a lot of questions popping up. But before we even talk about what they need to know, maybe some might be wondering for the first time watching, or someone might not have even heard of what IVF is. Maybe you should tell us a little about what IVF is.
So IVF is an acronym for in vitro fertilization.
Okay.
In vitro means something done outside the body.
Okay.
So IVF is an assisted method of fertilization or
Okay.
fertility where the egg and the sperms are fertilized in a specialized lab outside the body. That's what
Oh
usually
wow.
happens in the body. But with IVF, we're able to do this outside the body. Then what is when if sperm fertilizes an egg, what you get is an embryo. So
Yeah.
this embryo is incubated in this lab. Then after a few days, the embryo is now transferred back into the
Oh.
uterus, the endometrium
Okay.
of the woman, for
Wow.
implantation and pregnancy to happen, and then the baby continues to develop until delivery.
Okay.
Yes.
Well, there's just a lot going on in my head right now, but maybe I'll just take it one at a
One at a
time.
time. Yeah.
Yes, one at a time. Now you mentioned that eggs are collected, and then someone might be wondering how would they manufacture this egg from the woman, or how would they produce? Because this is something that the body automatically fertilizes, maybe
Yes.
during
A
maybe when
spontaneous,
exactly.
yeah.
So someone might be wondering how do they go about collecting this egg? Is
Eggs.
it that there's a way you people will just I don't know. How do you people go
Yeah, so
about
a
it?
woman is born, every woman is born with a certain number of eggs in her ovaries.
Mm,
So each menstrual cycle, these eggs start to develop from
okay.
the very primitive
Mm,
form. They now develop into the mature eggs that is now
mm,
released, ovulated, and then to collect these eggs, the woman is on a treatment. She's on
okay.
drugs. She's on
Mm,
medications. Then
okay.
when it's time for the eggs to be collected or retrieved, we take her
Mm,
to a specialized lab where
okay.
these eggs are retrieved through a minor surgical process.
Okay.
Yes, her tummy is not cut
Oh
open.
yeah, because a
Yes,
lot of them are
yes,
wondering,
no,
so
her
they'll
tummy
need
is
to
not cut.
cut me
No,
open.
we don't need to cut her open. So her tummy is not cut open. In fact, she goes home that very day.
Oh
Yes,
wow.
after she recovers from the effects of the drugs we give to, remove pain and,
Okay.
remove discomfort from the process. Yes.
Okay.
So
Oh
it's just
wow.
a minor surgical process that we use to retrieve the eggs.
Okay, for someone wondering that they have to cut you, because I know that I think sometimes back there were some posts. Some people will say, okay, they should I say, because some people are not aware.
Yes.
Some people have been victims of
Organ
organ harvests,
harvesting.
because
Yes.
the eggs, they will tell them it's egg collection that they are doing, and
Yes.
then you see them, they have cuts, and they tell, maybe they
Yeah.
probably told the lady that it's egg retrieval they are doing, and in her ignorance, she didn't even know that
No.
maybe one of her organs have
Have
been
been
harvested.
harvested. Yeah.
So a lot of people have actually gone through this lane due to ignorance. And then now she's letting us know that egg retrieval could actually, it's a minimal surgical
Minimally
procedure, and they
invasive.
don't have to
Yes.
incise you. I
Yes.
mean, they
No
don't have
open
to
cut
cut
into your
you to
tummy.
take it
Yes.
out. So please, let's be well informed so that you're also not someone does not abuse the fact that you're not aware of something, and then they do something to victimize you or something that is detrimental to you. Well, that's for the egg collection process. So um some people might be wanting to know how long the whole IVF process, because I'm sure
Okay.
you, knowing that this is your field, you might have a lot of people asking you, okay,
Yeah.
when should I come, or how long do I have to stay, and
Stay
all of that.
exactly.
Yes.
Yeah, we
So
get that a lot.
mm,
So the IVF treatment process takes different duration of times.
okay.
We have different treatment processes.
Mm,
So depending on the one the client is going through,
okay.
but I think on an average, I can just give an average range
Okay.
between 3 to 6 weeks. The
Okay.
whole process is completed. So it can be completed in as short as 3 weeks,
Okay.
even 4 weeks,
Mm.
5 weeks, but I think at most 6 weeks,
Okay.
depending on what we're doing for that particular client.
Person. Mm.
Yes, and then the way we work, we don't want to disrupt. We try to bring about little as possible disruption to the normal life of the client.
Mm.
So this whole duration of treatment, the client doesn't have to be on ground in our facility. Sometimes we do part of the treatment where the client is domiciled. So they only
Mm.
come for the most important steps at our facility
Oh
so that
wow.
we
So it's
shorten the
really
duration.
flexible.
Yes, flexible to make it flexible and
Mm.
more easy for people to be able to, adjust so it doesn't
Mm.
disrupt their lives too much.
Okay.
Yes, yes.
Okay. So, well, one of the regular questions that we get to hear from people, they would ask, what do I need to bring? Or they will ask, what are some of the tests that they would need me to do? Because I'm sure you deal with a lot of clients, both home and abroad. And you might
Yes.
have some of them that would say they don't have the luxury of time of coming to do some
Things
investigations
here.
here. They might want to do it where they stay. So let's let our viewers know some of these investigations that could possibly be recommended for them if they are preparing for IVF.
IVF.
So
Okay.
even when they are being told, they don't feel like someone is trying to extort them,
All right.
because some people feel like when you're asking them to do some tests, they're like, I
Yeah, you
did
see,
this.
yeah, you see clients
You
coming.
meet
I
some
want to do an IVF.
resistance. Mm,
Doing an IVF is not the first step. So the first step is evaluation,
mm,
and that's where the tests come in. Yeah,
yeah,
because we need to know what we're dealing with. Every IVF is not the same. The
it's
same
true.
things are not done for every client. Every client's issues or problems or medical challenge are different. Yeah,
Mm,
and to increase our success rate, a lot of those issues have to be taken care of before the IVF treatment process. So the first
yeah.
step in an IVF treatment process is evaluation.
Okay.
Yeah,
Hmm.
sometimes for our international clients, we do, even some clients in Nigeria that are so busy,
Yeah, I
to
don't
get
have
time
the
off work, we
luxury
do
of
online
time.
consultation. That consultation is very important. We
Hmm.
get to hear your history, your story. Yeah,
Yeah.
even from the history, we can, start it points us into the right direction
Hmm.
of what could be the likely cause of the infertility or the
Fertility.
challenge with getting
Hmm.
pregnant.
I
And
see.
that will tailor the investigations or tests we will do.
Okay.
We don't just do tests for the sake of doing tests.
Okay.
We tailor the tests to detect, to finding out the problems in these clients. So
Hmm.
different kinds of tests are done. One, we do screening test. We want
Okay.
to rule out any infective process because
Okay.
all this can also impact on the success of the IVF.
Yo,
So we do
wow.
screening tests such as hepatitis B screening, hepatitis C, HIV screening. We screen for diabetes. If a
Okay.
client is a known hypertensive, we do other tests to check that the heart, other parts of the cardiovascular system are
System.
working
Oh,
well.
wow.
Yes,
Hmm.
and We want blood, any hypertension, we want the blood pressure
To be under
controlled.
control.
If patient is diabetic, we want the
Mm.
sugar level controlled.
Yeah.
All the a well controlled sugar or blood pressure will also optimize success rate. You
Yeah.
know, can be skyrocketing, sugar levels in the sky.
Mm.
That's not a good process done
Mm.
on. So we
Okay.
do hormonals.
Okay.
Yes, especially for women. Once the hormonals gives us an idea about how the body is producing eggs. If the body is producing eggs, is this woman
Mm.
even ovulating?
Oh
Yes,
yeah.
so that gives us an idea. We do something we call AMH, anti-Mullerian hormone.
Okay.
This gives us, apart from this, gives an idea about the fertility potential of
Of
this
this
woman,
woman.
about
Oh
our
wow.
ovarian reserve.
Mm.
We always do a scan for the woman. A
Okay.
scan will also help us to look at the organs in the reproductive system. The
Okay.
uterus,
Mm.
we look at that to see if there are there fibroids. Does this one have adenomyosis?
Mm.
Does she have any issues with endometrium? Does it look as if there's adhesions in the endometrium? Are the
Yeah.
ovaries even there? The ovaries,
Mm.
this will give us an idea of, oh, why this woman has not been able to conceive
Conceive.
spontaneously, and then
Mm.
it helps us to know how to guide treatment.
Mm.
So the men are not left out. They do their screenings too.
Mm.
Seminal fluid analysis, very important.
Important. Mm.
Yes, so the sperms are checked to
Okay.
make sure that this man is producing sperm. How normal are the sperms that this man is producing?
Yeah.
So that is also checked. And then there are other specialized tests. Like I said, it is tailored to the client's problems and issues that the clients have. We might need to
Yeah.
do a hysteroscopy.
Okay. Hmm.
Yes, hysteroscopy helps us to look at the lining of the womb.
Oh wow.
Yes,
Hmm.
if there are polyps there, if there are masses there, if there are fibroids there, submucous fibroids, if
Hmm.
there are adhesions, all that could prevent pregnancy happening. So those things are taken care of at the hysteroscopy. Some
Okay.
women might need to have laparoscopy. Some
Hmm.
might need to have ovarian drilling. So, the
A
extent of
lot.
the test, it depends on
Hmm.
what we find. Though for
Hmm.
everybody, there's some basic tests. Some
That
people
they
might
will
need to
do.
have a thyroid function test done. We need to check prolactin levels.
Hmm.
So for a man
There's a
that has
lot.
maybe azoospermia or marked or very low sperm count, very, very low sperm count, we might need to further check the testes, do a scan, do
Hmm.
hormonals
Wow.
for that man.
Hmm.
Yeah, so we can't really put a blanket to the test, but know that whatever is done is required to give you the best treatment, to know how to
Hmm.
direct your treatment in such as a way as to achieve success.
Success.
Yeah.
Wow. So there's just a lot of viewers, and that's why you don't compare yourself with anyone's. You don't compare your treatment with anyone's treatment because, like Dr. Is that you're doing for everybody is being dealt with
As an
individually.
individual,
Yes, so your
yes.
treatment is individualized. And so when your physician or your fertility specialist is recommending some of these investigations, they shouldn't be alien to you because it's from the history that they get from you that they would recommend some of these investigations. I know you mentioned hysteroscopy. Is it everybody that you would recommend a hysteroscopy for, or there are some group of people that you would actually want to recommend a
Yeah,
hysteroscopy
so
for?
there are groups of people that would want to recommend stereoscopy for. So someone that's had a failed IVF before,
Okay.
and then we look at it and think the cause could be possibly from an endometrial cause.
Okay.
It would be good to do a hysteroscopy. Someone that's had a miscarriage with evacuation before, or
Mm,
D&C in the past. Someone
mm,
that's had a fibroid surgery in the past, because, or even a cesarean section, because the lining of the womb could be tampered with during this
mm.
procedure. So we want to do a stereoscopy to make sure that there are no issues. Even someone that, someone that is not getting pregnant, and then you
Pregnant
do a scan and you look at see find something suspicious
and
in the
lining.
endometrium, in the lining of the womb, we want to do a hysteroscopy.
Hysteroscopy to check.
Yes, we
So
want
you see that it's more like saying yes, everybody might not have hysteroscopy, but it
yes,
seems
like
like a very
majority
important and majority of
of people
people
might
might
may
have
need.
to go through
Yes.
hysteroscopy, and it's not it doesn't sound like an
It's
invasive
not.
procedure.
Hysteroscopy too is minimally invasive. The client recovers from the anesthesia and you
They
go
go
home
home
that
the
day.
same day. They
Yes.
are not cutting you
They're
too.
not cutting, we're not
So
cutting,
it's not
yes.
something for you viewers or people that might listen to this later. It's not something for you to be scared. There are all forms of investigations that need to be done just to be able to get an accurate course, and if they need to be
Yeah.
treated, so you're able to get success. Okay, yeah. So we've talked a lot about the tests that people do. Well, Princess, I've seen tend to that shortly, but then um, we've talked about some of the investigations that people do. But then I think maybe you should carry us through what this whole IVF process is about, maybe from beginning to end. Because now, okay, they know some of the investigations they
Yeah.
need to do,
Yeah.
but some of them might also need to know what the whole process entails. Because okay,
Okay.
they need to know, okay, am I just going to come one day and you will get the eggs, or
Okay, no.
am I
All
going?
right.
When is my
So, all
husband, and
right. So
also all
we
that.
yeah. So we
Mm,
stopped at investigations are part of the evaluation.
mm,
So the client is evaluated. We do our investigations. We get
yeah.
the results. These results are reviewed along with the client. We let them know. Okay, this is this. This is what we got. This is what this means. This is what this points to. So some people at this time might be able to proceed with the IVF immediately, but
Okay.
some other clients may need to have some procedures done.
Oh,
Yeah, for example, if we see huge fibroids, in the uterus,
yeah.
especially those ones just under the lining or even compromising the lining of the womb,
Mm.
those kind of fibroids have to come out. So that woman
Mm.
might even need to have a fibroid
Fibroid
surgery before
surgery.
we can even
Wow.
proceed with IVF. But
Mm.
let's say for a client that we can proceed directly into
To
the IVF.
IVF.
So IVF is usually started at particular times in a woman's menstrual cycle.
Okay.
So on the day she's with us, we asked her when she saw her last period, and we now calculate and know whether that's a time we could start. Even if
Okay.
it's not a time we could start, because we want to make it flexible and easy for our clients, we can give her the medications and then we direct her on the time she will start.
Start them.
So IVF, it's a process. It's not a one day. Process could
Mm.
be from between 3 to about 6 weeks. So
Yeah.
depending on the kind of IVF treatment we're doing, this one is on different forms of medication.
Okay.
Some are on injectables, some
Mm.
are on tablets. At some particular point in the treatment, we might need to start monitoring the ovaries, looking at the
Oh wow.
follicles.
Okay.
Yes, for those that are doing donor IVF, there's a time they'll come in to have a scan done to measure endometrial thickness.
Lining. Okay.
And then we get to the point where we say we want to trigger. We give her an injection to cause the eggs to be released. It's at this point that we get to egg retrieval.
Okay.
So she's
Mm.
going to be taken to the theater to retrieve the eggs. And like we've said, it's a minimally invasive procedure.
Procedure.
She's not cut open. She recovers from the anesthesia and she goes home that day. So
Mm.
when the eggs are retrieved, that's the day we need our partner's sperm, because the
Okay.
eggs will be fertilized with the sperm.
Oh,
Embryo transfer is between 3 to 5 days later. So
okay.
embryo transfer is the final step in the IVF treatment process. That's the
Mm.
day we return the embryos and place them, drop them on the lining, the
Oh wow.
endometrium of the woman.
Okay.
So that's the
Mm.
final process. Then pregnancy test is about 2 weeks later.
Okay.
So that's the way
The
they,
run of the
yes.
process.
And then if pregnancy test is positive, there are some medications we call luteal support drugs she needs to be on for about 8 weeks to further support the pregnancy.
Okay.
Yeah.
Okay, so dear viewers, she has just given us a run through of what this process is all about, so you know what to expect. And she also said, so embryo transfer too is also not a painful
No,
procedure.
if you're
Thing
not on
you
drug, you
see.
walk into the theater by yourself and you go out by yourself.
Mm.
It's a very
So
short procedure.
yes, and I think you might be able to see even when you might be able
Yeah,
to
we
have
show
some
them on the,
views
yes. You see
of
when
of
how the
of.
embryos are being dropped.
So
Yes.
you see that yes, it's a very very it's a procedure that needs to be handled with care,
Yeah.
but it's not a dangerous procedure
No,
that you need
it's
to
not.
be scared of. Yes, it's not, because a lot of people have this fear about IVF, and then it makes it difficult for them. Some of them even feel like maybe the babies gotten from IVF are not normal. You hear some people asking, and there was a video I even saw recently that was trending on TikTok. They said IVF babies are not normal babies.
Oh my God.
And the way in fact the way they manipulated things and said that that's how they generate these things, they made it look like it's something, they attach something demonic and
To
something
it.
spiritual to it, and you're wondering, these people, did they really, have they really taken
Take time
time
to
to
study and
study
to
and know
check
what this
this.
is all about?
Yeah.
Because all this will put people out and
Just
it will
put,
make people scared
yeah, just
and
put instill fear into
into
people.
people. Exactly. So it's good that you are making us understand these things so that people don't have a wrong mindset
Yeah.
or a wrong mentality about what
What
this is about.
IVF is
It's a
about.
technology that has actually come to help a lot of
Lots of
people.
families,
Like you
yes.
don't even want to know the number of people that have actually got to have their dream babies
Ways.
through
A lot
IVF.
of
Like a
people walking
lot.
about, a lot of children, a lot of
Yes,
adults are
yeah.
products of IVF.
IVF,
They're as normal
exactly.
as every other child.
Yeah.
Yeah.
So you shouldn't nurse those fears.
Mm.
Like, okay, in fact, as a matter of fact, as much as it seems hard for people to say, a lot of people that give testimonies, maybe they've had delayed conception. Some
Mm.
of them are IVF,
Yeah.
but most of them don't own up. Even if you
Yeah.
don't own up to say you did IVF, you shouldn't hoard the information.
Information,
You
especially
should
from
spread
people
this
that need it.
information to
Yeah.
people so people are able to access the truth and access the way, so they're able to also get your their babies just the way you've
Yeah.
gotten yours.
Shorten the time
That they
to
are
get
waiting.
people falling into the wrong hands. Yeah. And
Yeah.
then coming out more
Oh,
battered and worse off than they were before they accessed
honestly.
care in those places.
I mean,
Mm.
it's really a big menace sometimes when you see the way people don't want to be attached with I did IVF and you're
Yeah.
like, but this is what has given you
IVF is a
babies.
medical intervention like any other
Yeah.
medical intervention. It
The
is.
eggs, the sperm are
Are
still the
produced
same. It's just that
naturally.
fertilization is not.
Medicine cannot produce eggs as at
Mm,
now, cannot
mm,
produce sperm. So it is what God has put in your body. Just that
yes.
this fertilize they are removed and this fertilization is done outside the body. That's the assisted part of it. IVF is assisted fertility, it's not artificial. We're not
Mm,
creating anything. We're just assisting nature in a
mm.
way. Yes.
At least, we should be grateful to God that
Mm.
the technology has come.
Is
After all,
available.
there's a
Yeah.
part in the Bible that says greater work than I've done that you will do.
Do.
So if God has put that knowledge in the mind, in the hearts or in the minds of people, and they've been
Yeah.
able to show people the light, you shouldn't close your eyes to this light. You shouldn't close
Yeah.
your eye to this technology. You should embrace it and make
Yes.
use of it. There are people that actually, a lot of people that actually have even conceived spontaneously, but they are looking for a particular gender.
Yeah.
And then
IVF
IVF
does
is
a
the
lot
way
of
for
things.
them.
Yes.
So should they keep saying, let's keep trying, and then they keep giving birth
Go
to
to
the same gender
gender.
when they can actually access this technology and get whatever it is that they want. So please, if you have that if you have that wrong mindset about this, please, this lecture today or this live session today is to should I say is
Educate,
to yes is
enlighten.
to educate you, and it's also to disembark your mind from
From the
that wrong
wrong
mentality and
yes,
make you embrace and relearn a new mindset that would actually
exactly.
be of help. And then you could also, because of that knowledge, because you will also have some family members, maybe now the person is maybe someone like me, for instance, is having fertility issues. You share it with your family members, they've had their own children, you are the one
The only
struggling.
one,
They
yeah.
will discourage you.
Jew,
They don't
yeah.
just even want you, but then it seems like the only way for you. And then because of family members or close relatives
Tips.
or close friends, you are now restricted. Who's looking for the children? Is you
You
actually
and
that's
you don't have to
so
share your journey with
but
everybody. Yeah.
exactly. Mm.
Most times it's even better you leave it to when you have your results. Let the results speak for themselves. Yeah,
Mm.
especially when you have family members that are not supporting you.
Of this.
Yes, yes.
So even if you don't want to mention that it's IVF, if you try it for someone that doesn't want to mention it, and then do not hoard the information.
Yeah,
The fact you are telling somebody
don't tell
that
them a
you did
wrong information.
IVF,
It's better
yes,
you don't say anything than telling them I conceived spontaneously when you know
continuously,
it's not.
exactly.
It's better you
Or
don't share.
somebody that used
Yes.
donor egg, you now
No, tell
lie to
them
someone else that
yes.
you don't have to tell the person that is donor egg, but you
Yes.
also do not have to discourage the person and say,
Or
okay,
even
you
lie
must
because
or
maybe you
lie.
are in the same age bracket and that person now comes to the hospital and they tell her, Madam, at this stage, and the person is wondering why my friend said she used her own eggs,
Mm-mm.
and
So
they start continue wasting time and resources doing what
exactly.
might not really work. You know,
So please, you don't have to say it's donor egg.
Mm.
Yes, I know that
You don't want to
for
share that.
also the
Yes.
safety of the child, because sometimes some people could actually start looking at the child somewhere knowing that okay, use donor egg, because African mentality, they are yet to
Uh,
embrace some of these
more
things.
things.
But
Yes.
however, you don't have to discourage someone else from
So go
assessing.
to tell them,
Just
point them directly. You can go to this place, see
yeah.
this fertility
Mm.
specialist.
And whatever
Leave the
counsel
rest to
they
the
give you,
doctor. Yes,
just trust
follow.
them to and follow it.
Yes,
Even you,
yes.
at that point, tell them to follow, but you do not tell them that this is what
What
I
I
did.
did.
You
You don't have to
understand?
see.
So
Yeah,
there are a lot of
everybody's
ways.
treatment is different. Like I
Hmm.
mentioned, what your issues and our issues might not be totally the same.
Exactly.
So the fact that your treatment went this way doesn't mean their own treatment will go there. Just
Mm.
help them to be more
Open,
open-minded and embrace
yeah,
whatever they are
exactly.
told. Yes.
Okay, so we had a previous question for Princess. She asked if there are some supplements that people could take that could help enhance having a positive result from an IVF treatment. If there are supplements or foods that people need
Yeah,
to
so
take.
we okay. So apart from the IVF treatment, part of the things pre-IVF is to embrace a healthy lifestyle.
Okay.
There are people that are overweight or even obese. We
Hmm.
tell them to try to get to their ideal, body mass index, which is
Hmm.
between 18.5 to about 24.9. Weight loss has been shown to improve fertility in
Hmm.
women, and there are a lot of conditions that are associated with obesity, things
Okay.
like
Hmm.
polycystic ovary syndrome. So a woman that has polycystic ovary syndrome, if she loses weight, it helps to reduce the hormonal issues they have.
Okay.
Yeah, so
Oh,
there are
wow.
lots of supplements that could help fertility.
Hmm.
But these things are individualized. It depends on what we
Yeah.
find from the evaluations done.
Hmm.
But what I can share here is that for everyone, taking folic acid is not bad. For any woman that is wanting to conceive, taking
Hmm.
folic acid is very good. All these prenatal supplements are good, but there are other specialized ones that we tailor to different women and different conditions they have.
They
So when
have.
when they present in the hospital and we do our evaluation, there
Hmm.
are other supplements we still prescribe to
Okay.
clients.
Hmm.
Yes.
Okay, so hope that answers your question, Princess. Because yes, Dr. Debbie, Dr. Debbie, I don't know if you would want to talk more about the lifestyle,
Okay.
people lifestyle to maintain while praying for
Yes.
IVF.
Yes.
What's
So
what kind of
apart from
lifestyle should
maintaining a
they?
ideal weight,
Yeah.
stopping smoking, stopping alcohol,
Hmm.
reducing caffeine intake if you can't totally stop, so
Hmm.
that's some of it. And then eating a healthy diet, a diet high in carbohydrate, high in protein, high in vegetables, fruits,
Okay.
cutting down carbohydrates, cutting
Hmm.
down fats and oil,
Hmm.
exercising, incorporating exercise into your normal lifestyle. Those are some of the things that could help.
Okay, so it's more like stay healthy.
Healthy,
Hmm.
yes,
Stay
definitely,
healthy.
yes.
Processed food.
Should be minimized. Yeah, if you
Okay.
can't abstain
From
totally,
the
we don't
exactly.
want to remove all the enjoyment from
Oh
life, but
yeah.
minimize it, yes, as much as possible.
Everything in
But if you have,
moderation.
yeah, exactly, moderate. But if you have diabetes, you need to stick to your dietary,
Mm,
the advice that you've been given
okay.
by your doctor.
Because
Yes,
some of them don't stick to it.
yes. So
Yeah,
this is not
that's true.
a
It's
pass mark
not for you to
to
just
go
go
and
ahead
start.
and
Yes,
start.
so you stick to the dietary advice you've been given.
Okay, so are there some emotional counsel you give to people that are going through IVF? Because I know the medication sometimes have already has a tone on their
Yeah,
moods.
yeah.
So are there some emotional support or counsel that you give
Yeah.
to people
So
that are going through this?
yeah, so infertility is a very emotional journey. IVF itself, there are a
Yeah.
lot of emotions. Will it
Mm,
work? Will it succeed? So a lot of emotions are involved. So we just
yeah.
counsel them to stay positive.
Mm,
If you have support as in your partner being on the same page with you, that's great. Support from
mm,
family, from friends, very, very good. But you need to be positive. Yeah, some of the drugs can wreak some havoc with the emotions. Some of the drugs can bring about irritability, mood swings. Some of them can even make you add a little more
wait,
weight.
oh yeah, it's good you're talking about some of the side
Side effects,
effects.
yes.
Mm.
The fact that we're saying this, some people take them and they don't experience any
Any
pain.
of this.
Yes,
Mm,
pain at the injection site and all that. But just know that all these things are temporary and they're just part of the journey to achieving your dream of
mm,
achieving conception and then birthing the children you desire.
yeah.
So they're not forever. You're not like I said, the
Mm,
longest the treatment takes is about 6 weeks.
mm,
So you're not on these drugs forever. So just have a positive attitude towards the medications. Know that all
mm,
these drugs are helping to achieve your aim and your dream.
yeah.
And when that positive outlook and mindset really helps. It really helps so that
Mm,
you take everything in stride. If there are any issues, we're here. The medical team, the nurses, the doctors, we're all here to help you through whatever it is that you're
mm.
experiencing.
Okay, so dear viewers, all that she has said, it means just be happy
Yeah.
when you're doing this. Anything that you know
Don't
can
come
put
out.
you off,
Yeah.
can
Some
make
people
you
come,
angry, you try to.
grumpy, that kind of attitude doesn't help.
So you need to stay positive and be
Yeah.
happy. Keep a happy mood.
Yes.
Because I think there was one of those live sessions we're having, and I'm not sure if it's you or Dr. Ken that said that statistics have shown that people that are happy, they have more
Endorphins
to
secreted.
help with
Yes.
increasing their chances of
Yes,
succeeding.
exactly.
So so please stay happy, be happy, and have people, because sometimes when people, even generally people that seem to be very very moody and all,
You repel
you
people that
don't,
might, yeah, but
yeah,
you know those
exactly.
clients are, optimistic, have this happy attitude, positive mentality. They attract people. So
People,
even the
yeah,
nurse, the staff, everybody's attracted
everybody's
them. You
to
want to
them.
help them. Everybody's in line with them, that this person should succeed, this
Not a
person should succeed.
hostile, always fighting
Exactly.
everything.
Yes, yes.
It's good to ask questions, but then
Exactly.
yes, we're not saying you shouldn't ask your questions, but you don't have to be hostile
Mm.
and harsh. Yeah,
Yes.
even though I know it's a
Not
lot,
easy.
it's
Yeah.
a lot, it's
Mm.
a lot. Truly, it's a lot. It's difficult to actually help keep your emotions in check, but it's the extra effort that you actually need to make
Yeah.
just to see that you're happy and you achieve your dreams. So yes, we have a lot of, I think I mentioned one of them, that some people feel IVF babies are not normal babies, but I think there are some of the misconceptions that people have about IVF, or some of the myth that people already are nursing or people are holding as facts
Okay.
about IVF. What do you think are some of the misconceptions that people have about IVF?
Okay, I think one misconception people have is that IVF is 100% guarantee that it will work.
Okay. Oh
Yeah,
wow.
that's one misconception. Someone
Hmm.
has been trying to get pregnant, achieve conception, and
Hmm.
just feel once you do IVF, that is it. But
Hmm.
success rate for IVF, even wide, is between 33 to about 35%.
Okay.
So IVF doesn't always work. We need
Hmm.
to let people know that. Yeah, we thank God in our facility we have achieved success rates in the range of between 50 to 75%. And
Wow.
what has helped our success rate is all these evaluations, the evaluations we do before the IVF,
Hmm.
trying to tackle issues that could reduce the chances of success
Success.
even before the IVF. And that's why
IVF.
we counsel clients to be open to the counsels we give. You hear people telling you, I want to go ahead despite this. I want
This.
to go ahead, something is staring us in the face, pointing
Mm,
towards failure, and the client says, I want to go ahead despite that. Yes,
mm,
IVF is not 100%, but there are a lot of factors that make for success. The younger age of the woman,
mm.
the less when you're open to counsel, and you
Yeah.
take what because we are seeing the issues. We have been in this field. When
Yeah.
you're open to our counsel, you're likely to get your babies. You're likely to get your answers. You're likely to get it,
Answers.
when
Mm.
you're open to the counsel we give.
Okay, so what I can also take from what Dr. Debbie has just said is keep an open mind and don't be glued to your decisions. I mean, keep it open, that when they give you some of this counsel, ask questions where you're not clarified, but then be able to accept whatever options are given to you. It's all to help you succeed. Nobody would want to just give you any option like that if they are not all in a bid for you to succeed. So please keep it open, keep an open mind, and be ready to embrace some of those counsels that are given to you just to help you achieve your dreams. At least if you have a success with one and you decide that you want to play around with your next decision, that's up to you. But it's always good to keep an open mind to be able to accept the right choice so that you're able to maximize whatever it is given to you, and we hope for the best, even though yes, you could accept decisions and everything might seem to have gone well and IVF still fails, but at least you know that you tried your best. And that's where maybe they now want to start looking inwards again to reanalyze and check what might have possibly caused the failure. But please keep an open mind. So we have a question, Dr. Deborah from Choma. She said, do you do hysteroscopy after failed IVFs, after each failed IVF cycle? Hmm.
Yeah, we want to do hysteroscopy after a failed IVF, especially when we think the lining, the endometrium is the issue, but it must not necessarily be after
With
every
failed
failed IVF.
IVF.
Yes.
Okay. Okay. So hope that answers your question, Princess. It's not all failures that you just want to bump in and do. So it depends on what their findings are and what their analysis of things are before they recommend the hysteroscopy for you. So this is so me saying that she has done IVF 3 times, last year October and this year March, as they all failed. That she also did hysteroscopy 3 times. She says still wondering why all this happened to her and she doesn't have any other embryos to try. So apparently maybe she froze some embryos and all.
So
So
me, Prince will really
mm,
sorry about this experience you've had. I can imagine it has not been easy, but just want to still counsel you not to give up. You might still need to see your
Have a
fertility
revelation.
specialist and really sit down, let the children be reviewed, let them look at what they think could be responsible for all these failures.
Hmm.
And I'm sure there's something else they can still suggest to you, but you
Hmm.
need to be open to that
To that
suggestion. And if
suggestion.
you don't mind, we don't mind seeing you so
Hmm.
that we can look at it,
To plan.
together too and see what else we could do.
Hmm. Okay, so Sumi, thank you for asking that question. And sorry about your previous failure. I know it's not easy on you, know, but even one failure is not easy. Talk more of one, two, three. I know it has taken a lot of turns on you, but please do not give up. I know there are times that we've also heard from Dr. Ken or Dr. Deborah or Dr. Jane or any of the hosts that we've had, all any of our guests rather that we've had, and there are some people that have done IVF up to 5 times. I remember there was one that Dr. Ken said had done. Was it up to how many times? I can't. But I think he said up to 8 times or so. And then by the ninth or so, she succeeded. I know the monies too are not actually easy to come by, so it's not easy to pull the funds together to come. But then once you have the mind to do something, I know that you can always plan towards it. And like Dr. Deborah has said, you can always try and just see your fertility specialist. And then, like she said, if you don't mind, you could actually come to see us at Alps Hospital so they could do any basic analysis and evaluation, investigation that needs to be done. And then we could see what could possibly be the problem and hopefully address it and help you achieve your dream of having your baby or babies. So I hope that you find solace in our response from this chat. Thank you for asking once again. So we have Yemisi John asking, does age matter? That's coming to an IVF. Does age
Okay, so
matter?
age matters, yes and no.
Okay.
Yeah, if you're planning to use your own egg, then age matters.
Okay.
But even for a postmenopausal woman, IVF can still be the way for her to have her children. So age matters, yes or no. But if you're using your own egg, yes, age matters.
Okay. So hope that answers your question, Yemisi. Age matters and age does not matter depending on the kind of
What treatment
treatment.
you are having.
Okay, yes. So Rahila is seconding it that people honestly are
It's
secretive about
about it.
IVF.
Thank God you are listening to our live show.
Yes, thank you,
We
Rahila,
have to
for
be open as well. We're
that.
giving this information to you for
Yes,
free.
to enlighten the
Yeah,
public
yeah.
that no matter how you see it, IVF is not something that you just have to hoard. You know, yes, even if you don't want people to know you did IVF, let people recommend it for people.
Point
You
them
can
in the
tell
right
them to, yes,
direction.
point them in
Yes.
the right direction, and don't allow people to keep waiting when you know something that could be of help. And the Bible also says, "He that knows how to do good and does not do." So you see, if you know how to do good and then you are hoarding it, is a sin. So please do not hoard this information. So we have a comment coming from Eloho. She said, tested and trusted house. Dr. Debbie's advice had made her a mother today. She said, thank you, house hospital. Dr. Debbie, I think you can relate with this person.
Nice to hear from you, Madam Elomo.
Okay, so dear viewers, I know that there's just a lot about IVF that meets the eyes that people might not be able to understand. And no matter how we say we want to do this talk on IVF, it's really not going to end because there's just always one question or the other to address. You always have, and then I think there's some other questions that might be in people's mind because people might be going through IVF and they can ask, should I go about my normal life? Should I do exercise? Can I have sex? Or once I start IVF treatment, no sex anymore? I think that's a regular question that people ask.
So for I, we encourage you to go about your normal life. We don't want you lying on the bed 24/7.
Mm, mm.
That will even bring back pain. So go about your normal life. Just discourage them, especially after embryo transfer, from
Okay.
any heavy duty work,
Okay.
heavy lifting, and so on. Yes,
Mm.
after embryo transfer, we counsel that they abstain from sex.
Okay.
Yes, that's the only period we counsel they abstain from sex.
Okay.
Just go about your normal life. IVF, people get pregnant, some don't even know. So
Yeah.
IVF is not different, just that we're being more careful because we know the effort
That
and
you
the
put to
time
get
and the
to that
resources
point.
that
Yeah.
yes. But we encourage you to go about your normal life.
Okay, so I
Yes.
hope someone got that. So the fact that you're just starting IVF, me, if you're not clear about when to have sex or not, you can just ask your fertility specialist, but don't just assume because I think some women just say from when they are starting
From that
treatment,
consultation,
no,
they
no,
no, no, no.
exactly. get the counsel from your fertility specialist wherever you're accessing your care. Get counsel from them so you're able to be on the right track and you're not doing things that can actually just become a problem to you and you're not even aware yet. And then yes, so because some people also ask questions like after egg retrieval, what should they be doing? What's to expect after egg retrieval? Like, okay, are there some people that can have egg retrieval and then you don't do embryo transfer for them? You now play with the embryo transfer. Because so that when sometimes some of these things are coming friends and all that. Yes. Mm, yeah. Okay. No. Oh, wow. Okay. Okay. Oh, wow. So for a viewer that is wondering why didn't they do my embryo transfer 3 to 5 days after collection, Dr. Debbie has also let us know that it's possible for you to have that. So it depends on what your physician has actually seen, and they would explain things to you. I'm sure they won't also leave you in the dark. They will explain things to you and let you know why they are doing what they are doing. I think someone is also asking how long after a failed or unsuccessful IVF should one try again? And then okay, after maybe IVF has succeeded and maybe they give birth, how soon can they try again? So that's a question from someone.
So how long after you failed IVF? So once you've seen your first normal period,
Mm,
yeah, so we can see you day 19 to 21 after your first normal period.
okay.
Because after you failed IVF, you bleed.
Mm,
Yeah, so it would be good to still wait and see a normal period.
okay. What time that you put do back to back, like maybe as a person? Okay.
Or their
Mm,
desire, their wishes,
okay.
also try.
Oh wow. Okay. Okay, so okay, this person is asking from TikTok. I think we've actually addressed this question from TikTok before, asking if medications can be taken. That someone it seems to be medications for yes, if they are safe, maybe well, okay. Okay. So hope that answers your question from TikTok that those medications are not safe, you are preferring for conception.
Antihypertensive, they are not safe for a woman trying to conceive
Okay.
or during pregnancy. So,
Okay.
yeah. So if you
So
are hypertensive and you're on medications and
hmm.
you're planning for fertility treatment, you should inform your doctor so
Hmm.
your
Wow.
drugs can be changed to the ones appropriate.
Okay.
Yeah.
Okay. All right. That's fine. So we have rights. You know, sometimes I could do if I you don't say it, even though she's still talking about yeah, and why people actually really beats our imagination sometimes.
To do with this our African society and culture,
Mm, yeah.
people tend to stigmatize in a way people IVF. I
Mm,
think it's changing a bit, but still in some regions,
you still
people still
have it like that.
stigmatize people,
People.
yeah, that
Mm.
have their children through IVF treatment as if they are normal, they're not normal human
Baby
beings.
babies are
That
no
might be part of the reason, but it's not a tenable one for you not to. At least even if you don't want to share that you had an IVF, you can point someone in the right direction.
direction. Okay, so that's fine. So viewers, your questions keep popping and there's just a lot about your questions. We might not be able to exhaust all the questions today because of our time, but we must say that we appreciate you guys for joining. Thank you so much for staying tuned. For every one of us that kept us engaged in this live chat, we say thank you so much. And yes, we extend our love from Alps Hospital to you guys, and we really appreciate you for joining. Yes, I must also say, Dr. Deborah, it was very good to have you with us today. That was a very engaging and insightful session with you. So, viewers, please keep dropping your questions and your opinions. We'll definitely attend to them. If you're also not convinced, you could actually send a message to the number being displayed on the screen. We'll definitely attend to them. You could chat us on any of our social media handles or chat via WhatsApp with the number being displayed on our screen. We appreciate you guys for joining. Once again, I'm excited always to be your host, Ruth Ogugo. Have a lovely evening.